The next is going to be a fireside chat between Suzanne Hillinger and Dr. Eva K. Suzanne is an Emmy-winning documentary filmmaker. Most recently, she directed and produced a feature documentary called Totally Under Control. Totally Under Control was released less than a month ago on October 13, 2020, and it holds an approval rating of 99% of Rotten Tomatoes and follows the Trump administration response to the COVID-19 pandemic in the United States. It is an important testimony that holds an historical significance for the upcoming generation and for when they will look back at this pandemic. Dr. Eva K is the director of the Center for Operational Research in Medicine and Healthcare at Georgia Institute of Technology. She's an applied mathematician and operational researcher who applies combinatorial optimization of system biology to the study of healthcare, decision-making, and organizational transformation. She was also one of the first scientists who predicted the outbreak in the United States and the only scientist who dated the first patient case in China to be on November 15, 2019. Her model for China, built on January 23rd, predicted precisely how the disease spread in Wuhan. She's also one of the protagonists of Suzanne's documentary. I take great pride in having you both taking part in this event, so I'm going to shut up and leave the stage to you. Thank you so much.
Thank you. Hi, Eva.
Hi, Suzanne. Thank you, Marcello. I guess you're the one that put the title, The Science and Politics of COVID-19. And I think Suzanne is the red hot director. So I think she has a lot of materials. So in a sense, I always think that she's the one that really brings the science and the politics together in a way that is like accessible to the general public. So I like to know, like maybe start with asking her questions, like how she came up with the conception and also how she put all these materials together in such a way that is so moving and so powerful.
Yeah, so the film Totally Under Control, I have two other co-director and co-producers. There was no way I could have made a feature documentary in 5 months, which is what we did. Normally it takes, a year and a half to put together something like this. But it was really important to us in the early stages of developing the film to really look at what was happening in the US during the first few months of the pandemic response, January, February, March, as we were doing our research. And as you know, Eva, it's this period of containment in those early weeks are so crucial. Once there's widespread virus, it turns to mitigation. It's much harder to control. And, you're using a lot more resources that we knew at the beginning. Like somebody like you knew at the beginning, we had very, very limited resources. So we were really trying to track what those key decisions were made within the US federal government, and alongside trying to understand what scientists, what epidemiologists, what pandemic experts knew, and what information was getting from scientists to the government and what the government was doing or not doing, as we discovered with a lot of that information, which is, how I came to find you, which was, some documents that came to light through the New York Times in March, I believe, were these emails called the Red Dawn emails, which, really let us know what people within your scientific community and within the public health community, what you are all talking about in January. And it was so shocking to me. I'm not a scientist. I'm a filmmaker. I'm a storyteller. And really reading through those emails that you had with your colleagues, this wasn't a surprise. You had been tracking outbreaks like this for your whole career, and to see all of the warning signs that you knew, that you were sharing with people within, there were people within the government on these emails, was really surprising to me. So of course I wanted to call you to talk to you about it for the film, because I think that it's also very surprising for the non-scientific audience to understand, what information could have gotten communicated to us in those early weeks, in those early months. You have such a deep understanding of how the virus was spreading through the air, that I think if the U.S. if citizens across the world had understood better, but specifically in the U.S., we would have been able to get this virus much more under control. What was it? I'm so curious, what was it like for you to have all of the data and have been doing these modelings and trying to reach out to people within the government to let them know what was going on? Was it frustrating?
I think it's actually in some, yes, frustrating, but it maybe I feel really scary in a sense that, like, I thought it is interesting. Ben was saying that there will be more pandemic, but this is the pandemic of our lifetime. I truly believe if we could overcome this one, I think we could overcome a lot of things. But I think what you said really nailed it. Is the airborne, the aerosolized things. Because in a sense, my work, starting like more than almost 20 years ago, is really on aerosolized like transmission, right? How things transmit in through pipes and airborne and everything. And so it is difficult to really get the confirmation in a sense that we really felt the Diamond Princess really gave us a perfect environment to really confirm that. But first of all, we already know it's human-to-human transmission. That's absolutely no doubt, at least on my mind. And it is already confirmed even in Germany, is that like a week later, right, the Diamond Princess basically confirmed also, wow, it is like everywhere, surface, air, and aerosolized, and just everything you could think of. So I think it is difficult, and it's not like one could see what is happening in China, and they're locked down. So actually, I was still like shocking to think about, I built a model at the end, like basically in the middle of January. And I actually started looking at that even like late December, because I was trying to finish a paper on MERS and avian flu. I thought, well, I would just put a little example on the discussion. What little did I know, it was not really just a little localized thing. So I think there's so much that one can do, but it's perhaps politicians or like public health leaders never are ready for a pandemic, right? Because Ebola never took off, and it is not so easily transmitting through everywhere. So I think that's something for us to learn. But I think the documentary is amazing in a sense that the timeline couldn't possibly be like, dictated so well, right? Because you actually lay out January 3rd is when CDC leader knew about it. And yet we still don't have a national plan, exactly like what we're saying. So I think that's exciting. How do you feel about our next step, like in terms of, now we have all these things, and I know we talk about contact tracing, we talk about schools closing, and so do you feel that like we are marching forward, we will be able to march forward in a positive way with more scientists involved and more vocal in terms of like being able to be heard?
I hope so. I think that the last few months have been really damaging to the CDC and to Americans' trust in scientists. There's been a lot of misinformation that needs to be corrected. That's hard. Once a lie or once a misconception is out in the world, it's really hard to tell people that that's not true. And so much misinformation has been spread that I think I think it'll take a little bit of time to sort of right the ship. I'm encouraged that, President-elect Biden today announced his coronavirus task force. Dr. Rick Bright, who's also in the film, is one of the task force members, which is very exciting. But I think that it will take a lot of work to really earn the trust of people that, that these career scientists that, work for the government, they're public health professionals, they came into this work to try to help people, and save lives and provide good healthcare and good messaging about health protocols. And I think that they're going to have to sort of set a new tone that feels like a real shift, that feels like something new. Because, I think even though I trust those scientists coming in, I still remember in January, the Secretary of Health and Human Services, Alex Azar, he went in front of the news cameras and he said, we have a national plan and we're going to do contact tracing and we're going to do testing. And he said all of the right things, So I feel like we're going to hear people say the right things. They're saying the right things now. But I think until we see a program in place where if we can have a nationalized contact tracing program, if we can really get tests up and running in a wide way that, are rapid tests that work, that aren't rapid tests that have sort of unclear outcomes. I think it's going to take until we can really see the results of these programs to know that things are sort of on the right track.
Well, I think, it's kind of interesting what you mentioned about how scientists, what they talk about, and we have to earn the trust. I think is really interesting because one of the things that we talk about is people think that's the romanticism of if scientists tell the politicians or the decision makers, this is the right thing to do, and people will listen. But look at as simple as a face mask. From my point of view, I think when I said we must have, we must use face masks, it's even interesting. I'm one of the very few not career scientists, right? I like what you say also, a career scientist was the ones that serve the government. So I'm the one that's really outside. When I say, no, we must use face masks, and everybody said, oh, what is the science behind it? Okay, fine, right? And you have to really give them the evidence. And we actually show the evidence. Luckily there are other countries like Singapore and Taiwan and Hong Kong has it. So, but it takes so much effort to make people realize implementing it and make it work. And I think Germany recently showed it, I think beautifully, when I said face mask has to be used, 90% of the people have to be in compliance. And if not, then we won't get what we want, the result. And Germany really, I think they were able to sustain 90%, I think in June and July. And then August, they were unable to. It drops to 80%. And then you see escalation rate. So, it's amazing about the virus, how, in some sense, predictable it is because it is so easily transmissible. So, but I think it is a very interesting part, what we are looking at. And I think I do feel the whole idea of the contact tracing, maybe we can get into it. I think there is a lot of issues that we are looking at. So in Asia, for example, South Korea is a good example where they collect lots of data, and also because they have the SARS background, right? So they are willing and trusting the government to give them information. In Europe, they have developed the Google and Apple API, and they even in Germany they were able to connect lots of people, but the results were mixed. Okay, then how come to the United States? I think contact tracing is going to be challenging because more than half of the people will basically provide no information whatsoever. So I wonder, do you think that new administration, of course, I'm not asking you to speak, but do you think new administration will be able to, people like Rick Bright will be able to stand outside and say, hey, this is what we all have to do, and this is the plan that we have to move forward?
I wonder if they don't call it contact tracing, because I think there is this perception, certainly when you talk about contact tracing in South Korea, people are like, oh, they're tracking my phone, they know where I am. But contact tracing can be as simple as, I'm going to a restaurant and I'm going to give my name and my phone number. And if somebody got sick at the restaurant, they'll call me and let me know and I'll go get tested. I wonder if we just need a whole rebranding that, they need to do some kind of market research on how audiences would not feel threatened by giving their phone number. Yeah, I think that there needs to be sort of another way of doing it that doesn't feel like such a violation of privacy. I'm curious how it worked in Germany. Is it just sort of share, what are they using on the Google programs? Are they just putting their contact information? How does it work?
Actually, it's interesting. I know of the colleagues that are actually developing all of those, and so they have the Google API and Apple API that allows you to ping the phone that is close to the infected individual. And they have about 160 different software companies that come up with software that connect people with these things. It all works beautifully. There was actually nothing wrong with it, except I was a little surprised is that when they actually tested the individual, like, for example, if they tested me and I'm positive, then they have to actually put me literally onto the system saying, okay, this individual is positive. Now it triggers everything. Apparently that part was not feasible. So it's a very strange thing. But you might have actually pointed exactly. It's because of the new, the issue about the people would not want to give out information, right? For example, if I have the infection, I don't really want to be listed. And it could be official too. So we don't know at the moment. I talked to the German colleagues and they said amazing that it failed because it actually should work beautifully. And in other places, yes, they have a lot of problems. But I also like what you say about contact tracing, the name. So we call it a journal. It's like a diary of what your own activities is. So I don't know if that works. I mean, that's really a new term. But I think the interesting part is that people still don't understand testing and contact trace is the cornerstone, and it remains to be. But I think today, of course, there's the Pfizer vaccine, about a 90% efficacy. And I have a lot of questions there. I don't understand. As a scientist, of course, I will ask those questions. What does that mean to be 90% efficacy? Does it mean that they have challenged these vaccinated individuals with the virus and that 90% of them were protected, right? So we don't really know what is going on. So I wonder, from your point of view, how do you feel? I think your movie definitely is reaching out to a very broad audience. Do you see yourself as an agent to, in some sense, helping to disseminate some of these policies, for example, to make people understand what to do, and helping to translate those science or even policies into something that individuals will listen, because we are overdrowned with misinformation. Right. So how would you see we can overcome that?
Yeah, I mean, I think, storytelling is a really powerful tool to get information across in sort of an emotional way that people feel like they're listening and it's not just, a news story. So I think, if there would be documentaries I'm sure there are documentaries out there tracking some of these vaccine developments. And I think really understanding what goes into the process, part of what I think made this film so powerful is that we were just showing the process of what did we know when, who knew what did they do about it, what were the decisions made, and what was the outcome, just the facts, but you tell that in a first person story and people understand it and they believe you, because we do a lot of fact checking or making sure that we're telling the truth, but we're also letting people who were a part of the process in some way or understand, people like you who study the science in some way, share their story. That's it. And I think the same thing has to happen for vaccines. I think understanding, all these questions that you have about the vaccine study, what does 90% mean? If we could understand a bit more about what went into the research and development and the trial phases, and a bit about maybe the people who took the vaccines. I mean, that's really unprecedented in the medical world. They normally don't disclose. I mean, research and development in the medical world in general is a very protected phase. So it's, we typically don't, that stuff's typically not made public as far as I've experienced. Maybe that's not true, but I think that in this moment of this global pandemic, just like the government has an obligation to be overly communicative and overly transparent to the public. I think that these medical companies do too. And, I think we should know more than we normally do about the vaccine so that people can make their own decision. And also, I think the vaccine, getting people on board taking the vaccine is going to be hard. There's a lot of anti-vaccine rhetoric. A lot of people believe that vaccines are dangerous. It's going to take a lot to earn trust, and I think we do that through transparency. I don't know. What do you think it's going to take to get a vaccine that people will feel comfortable taking?
Well, I guess I have, like I said, I have a lot of questions because I do so much work in the vaccine development and immunogenicity prediction that will take 60 days after the vaccine trial is finished, and they have to collect all those data so that I can analyze. So I cannot wait. So I sent my first email out today. I said, I cannot wait to get all the data so I can understand exactly what exactly do they mean. And if they just mean antibodies were being found, right, and that it's high enough and that it show immune response, but that still does not mean the efficacy. We don't know yet. But I think it's interesting about vaccine uptake. For flu vaccine, only 1/3 of Americans take flu vaccine every year. So our in some sense, whether we have enough vaccines or not, that's another question, right? How do you allocate to different groups of people so that you get the best protection for the population? I think that's one of the very key questions. The other question is exactly who is going to take it and that it works. Because it is not so much about, because the traditional SARS vaccine had not been successful in the old days, like 2003. Now I'm very excited because it seems like many of these vaccines show great promises, but we still don't know who is going to be really benefit from it. I think that's the key part, is who is going to benefit from it and who would not be benefit from it, and how do we protect? And I am afraid people think, well, if they're going to take the vaccine, they will be protected and they don't have to wear a face mask, right? But that's really not a 0-1 solution. It's not yes or no. But I think my feeling is if we could get 40% of Americans take it, that would be already a very, very critical mass, because we don't need all Americans to take it, but we need enough of them so that we get enough coverage and that it is random. I think that is what I am most concerned at the moment, is with a lot of discussion. One group of the discussion in the government is they want high risk and they want the elderly, and the other group, they want essential workers. But nonetheless, that is not sufficient, because vaccine is to protect, of course, reduce mortality. It is also to reduce transmission, right? Transmission. Who are the one that is going to be transmitting it? All the young and healthy people. Exactly go back to what we said in, early February, that it is the healthy individual that carry those disease with no symptoms that is causing, all this spread. And if we don't address that part and we don't give vaccination to some of these individuals, then we won't be able to get enough coverage. So I'm really worried about, but of course we don't have enough vaccine. So, we're not going to have enough vaccine until probably next summer. So I think all of these has to be decided. So
do you think we'll need many vaccines from several different companies in order to have
absolutely that? Yeah, absolutely. I think even if one vaccine really works the best, I think heterogeneous approach is a must, right? Because you don't want everybody to have just the same vaccine. Well, that's from the supply chain and development part is infeasible, right? Because it's one line of production. But if I have multiple of them, then I will have a good variety of protection. And Denmark, not North Denmark, is giving us a lot of worries because of the little minks. And the virus is mutating, and there were questions coming up saying, are those vaccines that we are developing now, will that even be protective of the new mutated virus, right? So now we get into the whole concept of universal vaccine, the stuff that I'm doing for flu. Why is it important? Right? If there is really a genuine mutation that we cannot protect, like using just one type of vaccine, then it will push us to, another scientific breakthrough. So I think it's a lot of interesting part. I would say moving part, and I'm excited about all the clinical development. But of course, I love the data, so I think that's what I'm going to focus on, and I will ask a lot of questions and until I find the answer. Then that otherwise I won't stop asking. So yeah.
Do you think that COVID-19 will we ever be able to eradicate it, or would you think that in some shape or form we will be living with it forever?
I think we probably, because we have been dragging on it. Like if you look at the trend in the United States, right, we never enjoyed that deep like Europe. So we basically have like the third wave already, and every wave has more infection. And it seems to me from just the past two weeks I've been looking at it, a lot of people actually get infected so easily if they are exposed to just groups of people without face mask. They could rapidly actually get infected even if they have face masks, except their symptoms is a lot milder. So my feeling is that I'm hoping, even if because it is so closely related to cold and all of these things, so that means it is highly infectious, except that it is also quite deadly. So my feeling is that we are hoping it will mutate to a form where it is less deadly and more manageable, right? So can we control it? It's really, I thought that your it's kind of interesting. I have to say that the totally under control is an unbelievable term. So I mean, if you listen to me, and I, my husband worked in medical security, and I will always tell him that we cannot control it. We have no ability to control, but we are able to contain it, and we are able to mitigate it, and we are able to just suffocate it so that it is all gone, right? But controlling it will be so much harder, especially this virus was actually in existence for 40 to 70 years, apparently, among the bats. And the whole idea that it leaped into the human, and that in rural areas, even in China, 2 to 3% of the people were infected. It shows its resilience, right? And then it goes to the urban, like say New York City. So it is not like unexpected, but it is whether we can actually overcome it using our way of like the high compliance, right, of face mask and social distancing and smart school reopening. Because I think people always think about, can we open school? The answer is yes, but we cannot open school like we always do, because it has to be different, or else we won't be able to overcome it. And then we just keep, like, instead of like one step ahead of the virus, will be just chasing after its tail, right? I mean, this is exactly what we are. And I always say, we only need one step ahead. We don't need to be like many steps ahead, because we can't. But at least it's much better than like just keep chasing its tails and not being able to really implement things early enough. I think timing is really very critical.
Absolutely. I unfortunately have to go in a minute, but I'm curious, hopefully we'll have a new administration in January. What do you think the most important piece of scientific data or information should be communicated to the masses to sort of shift our fight?
I think the fight is that if we decide on the action that we are going to take, like the NPI or anything, time is what we don't have. And if they could think about it for 3 weeks and make a decision, or they make a decision right then and there, right? That's the time is really very critical. And we lost 9 months of the time. Amazing. I mean, but still, I think we can still catch up, but the catch up is a lot harder. And so I think that's like, they have to be decisive. And that is the part that is the hardest for policymakers, is that they always know there's a step that they have to execute, but they never seem to be able to execute. So hopefully, I think we will push them. I mean, everyone, I think the citizens and the scientists and everyone. So
great.
Yeah.
Well, keep pushing them. I could talk to you for another half an hour easily, Eva. So sorry, we've run out of time.
Yeah, no,
thank you so much. Thank you so much for both. It was such a wonderful conversation. I jumped in because I actually wanted to ask a question to Suzanne, but I know that you have to go. So it would be nice. No, if you can you stay 2 more minutes, or?
I can stay 2 more minutes. Yeah.
Fantastic. I'll try to be quick. So I often ask to panelists and always insist on the point that for real and true democracy, there needs to be strong information circulation, and that doesn't always happen. So most of the time, scientists produce a lot of data and a lot of information, but it struggles to get out there because it's hard to communicate. So I think that is in this sense, the work that you've done with Totally Under Control is extremely important in communicating what went wrong in the management of the pandemic and what scientists had to say about it. I wanted to ask you, did you have any indication, whatever that might be, that your documentary, Totally Under Control, had any impact on, even if tiny, on the US vote?
I mean, there's no way to know for sure. But I do know that the federal government response to the pandemic was the #1 issue for older Americans going to place their vote on Election Day. So, I'd like to think that if anybody watched the film and they were undecided, or they weren't going to vote, they didn't have a plan to vote, or they had family members who weren't going to vote, that hopefully, they saw the film and we were sort of able to condense information into a way that made it really understandable, reminded people what happened over the last few months. I like to think we had some small role. I think, we sort of did the best we could do given the medium that we work in.
Thank you so much. Thank you for taking the time to join this event, this Fireside Chat. I recommend everyone to go and watch Totally Under Control. It's available on Hulu, Apple TV, Amazon, and Google Play in Australia, Canada, and the US. And if you're in the UK, you're lucky you can get it on BBC. If you're not from any of those countries, then get a VPN and jump on one of those like I did. Thank you so much.